The day of your procedure has arrived. Having some anxiety or nervousness is very common and expected. After all, this is not something that most people have had a previous experience with. Upon arriving, you will be met by one of our surgical assistants who will be with you throughout the day.
One advantage of surgery here at Advanced Laser is that we commit to providing surgery to only one patient per day. This assures that you will have the complete attention of the doctor and his assistant for the entire time that you are in our office. Patients are brought into an exam room prior to surgery. Here, we will review each step of the day's schedule with you. Please feel free to ask any questions that you have. We will check your weight, blood pressure, and other vital signs. Most patients are given 2 medications at this point, one to lower blood pressure that may be raised due to nervousness and one to relax you. You will be asked to put on a disposable undergarment and an exam gown. The doctor will then see you. He will review your vitals, medical history, lab work, and consents. He will answer any last-minute questions and review the procedure. The doctor will then take preoperative medical photographs, mark the areas to be treated, and take some final pre-op photos. At this point, you will be given an injection for mild sedation and pain control. Prior to entering the operating room, you will be escorted to the restroom. Our operating room is set up to make your experience a pleasant one. It does not have the scary appearance of those seen on TV. It has soft colors, adjustable lighting, cable television, and satellite radio that you can enjoy.
Once in the operating room, you will be made comfortable on the table and attached to monitoring equipment. Tiny injections of anesthesia are injected at the sites where we will make small punctures for our entry ports. Once you are numb in these areas, a small puncture will be made with a surgical blade. Don't worry, you won't feel a thing. The actual procedure has 3 steps for each area to be treated. The infusion of local anesthesia to numb or freeze the area, the lasering to emulsify or melt the fat, and the aspiration or suctioning of the fat. These 3 steps are repeated over and over to all the areas to be treated. We use the same entry port for all 3 steps. The first step is the infusion of the anesthesia. A very thin stainless steel tube called a cannula is inserted under the skin. The anesthetic agent, known as tumescent fluid, runs through a tube from an IV bag through a pump to the cannula. The amount of fluid is carefully controlled and monitored. Additional areas to be treated are then anesthetized. Once this step is completed, we will allow you to rest, sleep, watch TV, snack, or drink for about 15 minutes. This allows time for the anesthesia to work effectively. The next step is the laser treatment. A very thin laser optic fiber is threaded through a 1 millimeter cannula, about the size of uncooked spaghetti. The fiber is connected to the actual laser box where all the settings and recordings are maintained. At Advanced Laser, we use only the latest state-of-the-art equipment and frequently are among the first in the country to acquire new technologies. Again, using the same entry ports, the laser will be inserted under the skin. The cannula allows the stiffening of the fiber to enable precise control. The cannula is then moved back and forth in a gentle manner while liquefying the fat. The amount of laser energy delivered is calculated and controlled by the surgeon. As an added precaution, skin temperatures are taken intermittently to assure your safety. During the procedure, our assistant will call out various numbers. These represent the amount of energy, or joules, used and the skin surface temperature. Additionally, since you are being monitored, you may hear your blood pressure, pulse, and blood oxygen levels being reported to the surgeon. The surgeon guides your procedure by his experience, checking the feel of the skin and the thickness of the fat while watching the laser beam as it is visible under the skin. Once the lasering of the area is completed, the final phase of aspiration will follow. This final step is the one our patients like the most. It's where you can actually see the fat flowing or being suctioned out of your body. At Advanced Laser, we use a special type of aspirating equipment not found at all centers. This is called Power-Assisted Lipoplasty, or PAL. The advantage of this system is that there is very little effort or trauma in the fat removal. The result of this is that there is less injury to the patient, therefore less bruising and quicker recovery times. The other important reason we use the PAL system is that it gives better results. There is less chance of skin ripples, divots, or depressions. A plastic tube is connected to the aspirator or vacuum. Then it attaches to a 3mm cannula attached to the PAL handpiece, which gently vibrates in multiple directions. The cannula is again introduced through the same entry portals and is moved back and forth in a gentle motion while aspirating or vacuuming the emulsified fat. We cannot estimate how much weight you will lose. We measure fat by volume, how many cc's have been removed. In general, the more fat there is in an area, the more that can be removed. Each and every patient is unique, and so is the amount of fat that can be removed from each area on each patient. Therefore, the results can vary also.
At this point, the surgery is complete. We will make you comfortable and begin preparing you for discharge. You will be cleaned as much as possible, and as much fluid as possible will be expressed or removed. Post-operative photographs will be taken. We will then place absorbent pads over all the entry ports to catch any residual draining fluids. Finally, we will place you into the post-operative compressive garment. After checking your vital signs, again, we will assist you in getting dressed in loose-fitting clothing. Prior to leaving the office, we will review post-op instructions with you and provide you with pain medication for home use should you require it. You are then released from the office to a responsible adult to drive you home.